Okay, thank you very much. So I'm Jody Nichols. I'm one of the Associate Directors of what was formerly known as the HSN and now Health Innovation in the North East and North Cumbria. My remit is twofold. So I support our CEO in developing our broader, wider ecosystem, and I also support our medical director in developing innovation tools within our health team. So in terms of why I'm here today, so firstly, I wanted to just present that we've gone through a period of change. So it's just so people are aware. So we have a new name, we have a new licensing period, but everything else beneath that is exactly the same. So we were formerly called the HSN, Academic Health Science Network, North East and North Cumbria. We've changed our name to Health Innovation, North East and North Cumbria, which essentially means we're exactly the same footprint. It's just the name that has changed. The name came around with the new relicensing. So it was all of the other HSNs and now HIs across England have all changed. So we're all now HIs, and you can identify where the HIs are based on their name. So you see there's HI North East, North Cumbria, there's HI in Humber, for example, and you can see that little map in the corner. You can see each one of the HIs. We were established in 2013 by NHS England, and we're one of 15 across the country. And next slide, please, if you can. Okay, so as I was saying, so while our name has changed, the vision remains absolutely the same. So our vision has always been, since our inception in 2013, to improve our health outcomes, to reduce health inequalities, and to boost our regional economy. We work closely with our integrated care system, our member organisations, including trusts and university, as well as industry partners, and we act as that trusted intermediary between cross-organisational work. And part of NHIP as well. So we're one of the 5 partners of the organisation NHIP, and we're working alongside those partners, and we continue to accelerate health innovation in our region and beyond. Next slide, please. So one of the reasons that I've been asked to come today is not only to present sort of the new era for HI, but also to present some work that we're doing to bring together that ecosystem, to bring together that space where people can work collaboratively for health innovation. And one of the pieces of work that has been developed alongside our ICB is the Health and Life Sciences Pledge for the North East and North Cumbria. Next slide, please. So the purpose of the pledge, the purpose of what we're doing is to, and you'll hear me mention this a lot, is to communicate, collaborate and celebrate. So why do we communicate? To share our journey, and to why we need the pledge, to collaborate, to bring together our key stakeholders and co-create a community-led approach, which I'll go into detail in a bit more in a second, and to celebrate, to have some fun as a community, to celebrate our pledges, and again, I'll go into them in a second, and to showcase our strengths as a region. Ultimately, what we want to do is encourage, enable and empower better research and innovation to take place across our region, ultimately helping to save lives, improve livelihoods and to promote our economic growth. Next slide, please. So this all comes back to the Health and Life Sciences Pledge, and all the work fundamentally within the HI, formerly HSN, all comes back to what is, I would say, is our golden thread, the innovation pathway. So essentially everything we do in our organisation can be mapped back to this structure here, what you see in front of you. And I'll just quickly go over it. So the idea of this map is to enable us to support innovators to move across this infrastructure, understanding what they would need at what point in order to get their innovation to grow, essentially. So you would have innovators that would come to you really early stage, and they would need market research or look at securing their IP, which is in the blue section on the left, all the way through to innovators that will approach us, and you would look at developing scale-up or regional adoption, national spread and adoption. The bit that I've been focusing on primarily for the Health and Life Sciences Pledge is, you can see that the white rectangle around the hexagons itself, and its partner support and services. So the idea of what I've been doing is mapping, working together with our ecosystem and mapping what our partners do to support innovators and at what point they can be accessed and what their value add is in the system. And that is all being mapped. So this map is again live and interactive on our website, and you can understand, and when you click on each hexagon, you can understand what provider provides what, at what point, and how you can access them. If you can go on to the next slide, please. So what is the Health and Life Sciences Pledge? The Health and Life Sciences Pledge is a promise, no more than that, to encourage, enable and to empower more research and innovation by bringing together our key stakeholders to better communicate, collaborate and celebrate, and ultimately save lives and improve livelihoods. Now, this is really light touch, and it's been done that way on purpose. We've not wanted to make this into sort of an agreement, an MOU or anything like that. The idea is that it's really light touch to allow as many people as possible, as many organisations as possible, to join the pledge and to join in this movement that we're creating. Next slide, please. Why a pledge? It provides a cohesive and collective complementary inclusive campaign that helps us to pull together and push out forward with pride, passion and positivity. The idea is, as I've just said, keeping it really light touch and allow as many organisations as possible to showcase what they can do and really showcase the North East and North Cumbria as a space that we can really help innovators. Next slide, please. Some of our critical success factors. So there's 4 here: to help and support reduction of health inequalities in the North East and North Cumbria, to improve and increase investment in our region, to promote and support economic growth across our region, and to become a national exemplar, a hub of excellence for health and social care. So I have a personal goal to make sure that we get some national recognition from the rest of the country about some of the really well-developed ecosystem that we have in the North East and North Cumbria, and that's part of that national exemplar, that hub of excellence, to create something that the rest of the country can look at and say, wow, how did they do that? How did they create that ecosystem? Next slide, please. So what is the Health and Life Sciences Pledge? So you've heard me mention the 3 C's. So it's to better communicate, to share good learning, good practice with fellow stakeholders to help continuously improve and enhance the ecosystem itself. Excuse me, to collaborate, to work together in an open, trusted and transparent manner, to identify unmet needs and refer research and innovation to appropriate stakeholders, to speed up that referral process across that pathway itself, to help speed up the journey that innovators take, ensure that both the innovators, innovations and innovators get the right support at the right time to enable them to get to where they need to be in a timely manner, and to celebrate, to share individual and collective stories and promote our regional and to promote our region nationally and internationally, and help inspire those and to help them to realise their ambitions. Next slide, please. And what will we deliver? So as a Health and Life Sciences Pledge, obviously working alongside our ICB to encourage, what we want to do is encourage more innovation to take place across our region through the pledge, and that is aimed at identifying unmet needs, to enable all stakeholders to realise their innovation potential by providing the right support at the right time through that pathway, and managing and monitoring that and maintaining the ecosystem on behalf of the stakeholders, and to empower our innovators, both industry and NHS, to navigate across the pathway by providing tools and techniques and essentially hand-holding some people, if they need, across the pathway in order them to make sure that their innovation gets to where it needs to be. Next slide, please. So the action-led approach, this is a really important slide for me. So in terms of the pledge, this is sort of around about 2.5 years worth of work to get us to this point. We did a significant amount of stakeholder engagement during COVID, unfortunately, so it was a lot on Teams and online. We were able to communicate and talk to our key stakeholders to help us to understand what they would like if we were to deliver something like this. So this is an action-led approach. And this is what they came back with after that significant engagement. I think there was over 6 stakeholder sessions that were held across the region to really start to pull through what people would want. And what people wanted under the 3 C's to communicate was to develop a website, which we have, develop pin badges. I know that sounds really simple, but it's actually been really effective. And the pin badge itself is what looks like the 3 circles in the corner, and the launching of the pledge. So we have launched twice. We've launched in Newcastle initially in March earlier this year, which was a fabulous event at the Vermont in Newcastle. We had over 100 people attend. What we quickly realised is that we should launch again in Cumbria to make sure that we're inclusive to our Cumbria partners. So again, we launched again in Cumbria, and that was a little bit later in the year, and that was in late June. Again, really fantastic event with some really key stakeholders to really help to cement those relationships as we move forward. We have founder pledgees, which we do right now. We have over 100 pledgees, but I will go into that in a second. We develop monthly newsletters. Haven't got enough confidence to do the podcasts yet, but I will do them as we move along. We have networking events. We have regular events. We've just had our an event last month which focused on understanding the landscape and the changing landscape around people's relicensing or rebranding or changing footprints, etc. And that was last week, and NHIP was part of that as well. And then moving into the Collaborate, we launched looking at unmet need challenges, again working with our ICB. We haven't got round to this yet, but that's part of the process, and the work that we're developing is around looking at unmet need challenges. Developing discovery sessions around the region, again, that's part of that work. Developing the Northern Diamond, and for me, that's around developing that ecosystem and really making us a hub, a central hub in the north that we can be identified for. Addressing unmet need challenges or addressing challenges. So this was something that was, so I thought we really worked really well. A challenge that we went through was that we went to a college in Newcastle called UTC, which is a STEM-based college, with some of our team, some academics, with the idea that we were going to talk to the students about the uptake of HPV vaccine. 16-year-old, 18-year-old students. The vaccine uptake in certain areas in the northeast is particularly low, less than 10%. So we went into the college and asked the students, split them into groups, and asked them to design an innovation to help improve the uptake of this vaccine. We had some amazing ideas come through, and the winner of that, there was a little competition, and the winner of that is hopefully going to go on and have that opportunity realised in terms of creating that innovation. So it's really powerful sort of opportunity for the students to direct an innovation that could directly impact them. There's obviously using shared learning and developing the IP corridor. And then to celebrate, moving on to launching, looking at awards, doing research innovation publications. Some of these we haven't got around to yet, but it's all part of the roadmap. And looking at trade missions, looking at international visits, showcase events, and looking at PR and social media campaign. Again, all part of the work that we're doing. If we can go on to the next slide, please. So progress to date, we have 160 organisations engaged as part of the infrastructure mapped into that wider innovation pathway map. We now have, this is ever so slightly out of date, we now have 111 organisations signed up as part of the Health and Life Sciences Pledge as of yesterday, which is absolutely fantastic, considering we launched in March. We're working in partnership with the ICB, so around that research and innovation agenda. We've redesigned, as part of this wider work, we've redesigned our innovation pathway and processes, our triage process, our navigators. There's an interactive map, so you can really see some of the work that we've been doing, like clicking on the hexagons, understanding who sits where. And we're looking at highlighting our unique assets, our unique infrastructure, and our relationships and friendships. And I think this is not something that should be overlooked or taken lightly. Our relationships and friendliness and friendships is something that holds our ecosystem together, and something really important as part of this pledge. And as I said, we've launched in Cumbria and Newcastle. We have regular newsletters and events that go on across the region, and we also attend in regional and national events to really showcase what we're doing. So MedTech, Confed, MedConnect, NCOM, for example. Next slide, please. So these are just the last two slides, just a couple of slides to show some of the pledge in action. So these were taken across the region at different events, whether it's UTC or engagement events. So UTC was the STEM college that I was just referring to, engagement events across the region, and work that we're doing to engage and develop the wider pledge. If you go on to the next slide. Again, this is just a few slides from across the region, from the launch in March earlier this year, and then from the March launch at the top, which was the Newcastle-based one, and then at the bottom was the Cumbria-based launch. Just a few pictures of the depth and breadth of people that were at the event. And I think that's the end of my presentation.
Well done, Jody. That's brilliant. Despite a few gremlins at the start, you still managed to keep to time. So that's really well done. So thanks to all colleagues who've joined us. If you do want to ask a question in reality rather than actually typing it, just put your virtual hand up, and I should see your name in the participants panel, or type it in if that's all right. Whilst you're thinking. Can I just ask Jody? Well, I've got to be honest, there's a few questions, but a couple that come to mind. I mean, is Health Innovation Northeast North Cumbria the only health innovation network to have a thing like the pledge? And if the answer to that is yes, what added value do you anticipate coming out from the pledge over and above what other health innovation areas are doing? What do you think the USP or the value added would be for it?
Yeah, good question, David. Great question. So, as far as I'm aware, yes, we're the only health innovation, or previously HSN, that has something that has developed an ecosystem like this and a pledge to bring the ecosystem together. And for me, the added value is I think the reason why we can do this and that creates the added value is because our unique assets and infrastructure that we have in the Northeast. So not only do we know each other, we actually really enjoy working with each other. I've talked to the majority of the other HIs or AHSNs across the country about the work that we're doing. And unfortunately, their relationships are not as close. So therefore, I think that impedes development of innovation. If you've got a close working relationship and you can refer people at pace and scale, then it speeds up that journey and it creates the energy about what's happening. And I think that's part of the USP.
Great. Thank you very much. I mean, the one thing that struck me looking at your numbers, which are climbing all the time, of sign-ups to being, pledgees, as you call them. I think that's a new word for me. It's a good one, pledgee. So I'm guessing that exceeds the membership, does it, of the Health Innovation Northeast North Cumbria? So in other words, if you were looking at it at a Venn diagram, would you have sort of members who are, say, subscription paying, like Newcastle University, to Health Innovation Northeast North Cumbria? But do you have a wider penumbra around that of pledgees who are not members of Health Innovation?
Yeah, so it's much broader than the paying members, absolutely. So yeah, so much broader than that, and it exceeds that. So yes, I'm not sure exactly of the paying members beyond the trust. I don't have that exact number on me now, but yes, so having 108 people sign up to a pledgee is far beyond that.
Yeah, it's a very, very large number, actually. It really is. I suppose in a way that might be another answer to my first question, in terms of the value added. You're extending the reach into other spaces as well. And are you, I'm hogging the questions here because nobody's putting their hands up or speaking, but might as well, hopefully this is helping other people getting a sense of this. I mean, I saw the R word featured at one point in your presentation research, but I'm assuming the pledge is primarily around core business for health innovation, which is as your name suggests, in innovation. Is that correct?
Yeah, absolutely. It is. But in terms of, it's based around the innovation pathway, and research is part of that, and evaluation is part of that. So it's part of that infrastructure, and it falls under the innovation and research part of the ICB.
No, that's it. Yeah. No, okay. No, I'm so aware of the ICB, but that's a good answer. I mean, just the colleagues are aware that, Nicola made I'm sure through colleagues like Jody, made a really great contribution from what was formerly known as the Academic Health Science Network to the application for our Academic Health Science Centre, NHIP, and the pathway was actually part of the application. So it just goes back to what Jody's saying about the value of close teamwork. Now, whilst I've been talking, a question has come in there from Beth saying, Jody, you can probably read that yourself. How are you linked to the Health Innovations neighbourhood? Right. So just by word of explanation, that is I'm thinking, Beth, what you're meaning is that's the site formerly known as the Campus for Ageing and Vitality, formerly known as Newcastle General Hospital, Jody. So I think you could answer that one of a couple of ways, couldn't you, really?
Yeah. So right now we're based at the CAV. So the Health Innovations home base is in the Centre for Ageing Vitality, next to the Cresta Clinic at the back of the site. So we're very much based in there at the moment while the site's getting regenerated.
Yeah, and I think Beth as well. I'm not sure what's behind your question, but very welcome. I mean, I think that health innovations also quite strongly linked, and Jody will know this, to infrastructure like the Health Tech Research Collaborative, and we're obviously looking to try and have a presence for that as part of Diagnostics Northeast on the health innovation side, which would provide, if you like, albeit it's somewhat indirect, but nevertheless a very obvious linkage across to health innovation work as well. So it comes back to Jody's point about us all being really very joined up as a group of partners, which is it's absolutely right what she said as well, that the same cannot be said for other areas. And we hear that repeatedly. All of us hear that repeatedly on our travels, I'm sure.
Yeah.
So Sarah's asked a question. Oh, great. So a clinical research nurse, if I had an idea, oh, right. If I had an idea for a phone app, I would have no idea where to start. Could this partnership help develop that idea? That's a great question, Sarah. Jody.
Sarah, that's a fab idea. Yes, absolutely. That's part of the work that we do as an organisation, as health innovation, but NHIP as well, and to support you as an innovator to develop your innovation. So more than happy for you to get in touch, and we can support you the best way we can. I'm sure that Beth would send you my contact details, or the presentation would have my details on. Just get in touch, please.
Yeah, I mean, actually, that resonates really with me a lot, that Sarah, that question, because it cropped up in a different context just recently, that so many people who are working, if you like, at the front line have got fantastic ideas that are often driven by unmet need in patients and citizens. And we just don't have an effective way often of channeling those ideas or helping guide the person through what really looks like a bewildering set of infrastructure to get through. So I think the more we can have a point of contact, like Jody's just given there, the better. Yeah. So, and then Paul's pitched in there about a nurse in West Yorkshire with an idea for now. Have a look at treacle.me. So there you go. There's a few ideas coming in. We're all going to start Googling treacle.me now, I think. Right. Any other questions for Jody? Any other comments? If not, I'm not seeing any hands. Just double check. I'm not seeing any more comments. So Jody, that's great. I mean, ever so kind of you. I think you've had a very diverse audience there. So obviously, hopefully that's helped you as well get the word out a bit more about health innovation and the pledge. We're going to draw this to a halt, as I promised, just before past. So good luck with whatever meeting you're at, Jody, and appreciate you phoning in from there. Thank you. And thanks all for your time. See you at the next lightning talk.
Thank you very much, David.
All right.
Thank you.
Bye, everyone. Bye-bye. Bye-bye.